well, we'll go ahead and get started because it is 2. Welcome everybody to Health Programming at Your Library. I appreciate you joining us today. My name is Christy Anderson, and I am the Executive Director of Region 2 of the Network of the National Library of Medicine. And we are based out of MUSC, the Medical University of South Carolina in Charleston, South Carolina, so right along the coast. I'm so glad to be here today and joining you guys. So I have just a few informational items to share before we start our session. Captions are available if you'd like to use them. Just click the CC button at the bottom of your screen. If you don't see the CC button, if you'll locate the 3 dots at the bottom of your screen and then choose the closed caption selection. Everyone's microphones have been muted to cut back on background noises and any distractions, but we still welcome your participation through questions and comments in the chats and your reactions. One of the things past participants have enjoyed about this class is the exchange of ideas with others in the class, so please don't hesitate to share your ideas. Just drop them in the chat anytime. Margie Shepard is joining us from the National Training Office, and she's going to be monitoring the chat. So please be sure to post to everyone in the chat. That way both Margie and I can see them, and Margie will queue up the questions as they come in and save them for us to toward the end of it. And we will address them during one of our question breaks. Okay. So to get things started, I have a question for you guys. When you think about health programming for your community, which picture most closely resembles how you feel? Put your response in the chat, and if you're up for it, add a little note on why you feel that way. So A is a hand planting seeds in the dirt, B is a raft and whitewater, C is a large maze, and D is a ballet dancer. So as you think about health programming for your community, which one of those kind of aligns with what you think? So I see several C's and some A's. I say A, haven't done one in a long time, not sure what would bring people out. That's a good question. A, touch dirt. Well, there's a D and a B. Oh, I like Marissa said C is representing the interconnectedness of programming and partners. Great, thank you guys for participating and giving us some answers. So what this is, what this shows us is that we all bring different feelings, experiences, and expectations about planning and implementing health program for our communities. This class is not a full how-to, but it will provide information and resources to support you in getting started and getting ideas in this area, as there is a lot to experience and to consider. So in this session, we're going to discuss the purpose of conducting health outreach programs for libraries. We're going to create an initial plan for the development and implementation of health outreach programming in your library with ideas and examples from big to small. We'll identify some potential partnerships for health programming and outreach. And then we'll identify resources from the National Library of Medicine and other reputable agencies that can be used to support the implementation of health programming. So Margie has dropped the handout in our link, the link to our handout in the chat. So it's there and available if you would like to check it out now. Before we really dive in, I want to just briefly introduce those who aren't familiar with the network of the National Library of Medicine. To us, it's also known as the NNLM. As the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. We are an education and outreach platform for the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. but we are also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. This includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. We do this primarily through two ways. One is training and education opportunities, and two is outreach and engagement. We offer a wide range of training and education opportunities like we're doing here today, as well as panels, discussions, webinar series on special topics, just a whole host of opportunities. At NNLM, our mission is to provide equal access to biomedical information to health professionals, as well as access to quality health information and to the general public so that they are better able to make their informed decisions on their own about their health. So let's get a little more input from you. There's a spectrum of ways to incorporate health outreach and programming, and it's very wide. It can be sometimes passive or active. An example of passive outreach might be a library partnering with a local nonprofit to provide free menstrual products. On the other hand, health programming might also include a session for seniors about how to find reliable health information online. If you have anything lately that's caught your eye, tell us about it in the chat. And I see that Jen has shared that their local library provides free menstrual products. And I know I've worked at a previous college library where we brought in and we had a basket of not just products, but like toiletries and things of that nature, where if we went to any conferences or trips, we would bring those back so that the students who were financially unable to have those, little luxuries, they were able to take those for free and not have to be embarrassed to ask for anything. Oh, and Christy just shared that she's offering a free computer basic skills and basic handheld device classes, which is great because a lot of older people especially don't know how to use those. So why might libraries conduct health outreach? Libraries are often community hubs with public libraries across the country receiving up to 4 million visits a day. Many consider libraries to be trusted providers of information and community resources, including health information. The Pew Research Center in 2016 reported that 38% of people using libraries did so to seek out health information. Libraries have existing partnerships, and hopefully local resources that are in tune with what their particular community needs. One reason to offer health outreach in your community is that in today's complex information environment, we have a greater responsibility to communicate the resources and expertise that exist in our communities. Libraries, community centers, and faith-based organizations are often heavily utilized when someone has a question on just about any topic. They are often the starting points for information seeking on various topics, including health. Providing current and timely health information enhances the image and visibility of library or organization in the community, while offering health programming helps keep the library relevant to its users. Health events and resources increase a library's visibility and inevitably shows the library's overall value to community members and leaders. Finally, an added bonus is by adequately preparing for health programming and outreach, you stay in tune and current with your health needs of your own community. And just a quick note to recognize where we are today in the health and outreach programming landscape. We hope that you are enjoying and will learn about some of the resources and projects that other people are doing and sharing with each other. Library people are ambitious people, and we want to find inspiration, but we hope that you don't feel overwhelmed or compelled to do all the things. These are just suggestions and ideas, and you can feel free to take them and kind of change them and adapt them to what your needs are in your own personal organization or community. Many of you and your colleagues are experiencing similar challenges and staff capacity, funding insecurity, social and political pressures. So we all have a lot of obstacles that we face, and nobody expects us to do everything. All of these things play into what we can do and what we may choose to do at any time, or offer to our communities. If health outreach is new to you in your library or organization, it may be helpful for you to begin by locating information on your community's health needs. This is the first competency of the Consumer Health Information Specialization from the Medical Library Association, or like we call it MLA. Learning about the demographics, health issues, strengths, and challenges of your area can help you better meet the needs of your community. Offering programs that align with the needs of the community are more likely to positively impact your community. Also, grant funders sometimes require justifications for funded program activities, so it's good to make sure that you can demonstrate how your projects are in alignment with your community. I'm a firm believer that librarians and community advocates are uniquely in tune with the needs of the communities in ways that others are not. We are just frontline workers. So step one is to planning your health outreach is knowing where to find some quality statistics to back up what you might already be observing and your patrons as they come in and out. I'm going to give you an overview of 3 resources to learn more about your community, and we'll look briefly at all 3 of them, and then I'll give you some time to explore them on your own. State Health Facts provides free, up-to-date, and easy-to-use health data for all 50 states and the District of Columbia, as well as counties, territories, and other geographies. Data available on State Health Facts comes from a wide variety of public and private sources, including Kaiser Family Foundation reports, public websites, government surveys, and reports in private organizations. This resource focuses on providing information at the state level. So if you're interested in offering a program on diabetes, for example, you can find information on health status indicators for your state on diabetes, as well as information such as the percentage of adults who have been told by a doctor that they have diabetes in your area. Okay. The second resource we have here is the County Health Rankings and Roadmaps. This is a program of the University of Wisconsin Population Health Institute with support from the Robert Wood Johnson Foundation. It is another excellent place to find us to start looking for information about health issues in your community. As you might guess from the name, this website provides health data at the county level. Choose your state and then your county, and then you can scan the data through the data and get a sense of the information provided. Unfortunately, come December, this website will no longer be funded, but the information will be good for, I would say, the next year or so. So you could still feel free to use it. It's free to use. You might want to go ahead and capture your county's data while it's being updated still. Here you can see that we've pulled Wyandotte County in Kansas, and I apologize if I have mispronounced that. In the upper right, this graphic tells me how this county fares compared to the rest of the counties in Kansas and the rest of the US. Salt Lake County has better health outcomes than the average county in the state and in the nation. And below, you see selected a particular health outcome. It's premature death. You will also see a definition of the health outcome followed by how recent the data is. Also notice an itty-bitty graph icon. You can further explore trends in the metric. You can also download the chart for use in in a report or presentation, or look at the data on the map. Some metrics you can disaggregate by race or ethnicity, or to examine for health disparities. So it really breaks it down for you. Here's one more snapshot of the county rankings and roadmaps. Near the top of the table, there's a checkbox for show areas to explore and areas of strength. Clicking the box will highlight any red flag areas in your county that are potential challenges to health. Clicking on areas of strength show just that. It's the bright side of the community conditions. Make note of these and any other areas that really stand out to you for your county. For example, if libraries need to justify the need to purchase materials for a program on a given topic, whether you're presenting it to library boards, trustees, local municipalities, you can use the county health rankings and roadmaps to locate information on your county and compare them to other counties or in other states that there is an identified need to raise awareness on any given topic. And finally, we'll narrow it down a bit more. And this is the City Health Dashboard. This resource allows you to see where the nation's 500 largest cities stand on 36 key measures of health and factors affecting health across 5 areas. This includes health behaviors, social and economic factors, physical environment, health outcomes, and clinical care. These categories align with those used in the county health rankings and roadmaps. In this case, we've pulled up the air pollution and ozone metric for Denver. The bar shows the bar shows that how Denver compares to other counties in the dashboard. It notes that the lower measure in this case is better and will include a green check mark if the value is better than the average. These dashboards are incredibly rich. You can look at the city overview and see how a city is doing compared to the others in the dashboard. You can zoom in on particular aspects and get detailed geographic or demographic information. Here I have Charleston, South Carolina, which is the home of Region 2. Overall, Charleston has reported lower incidence of diabetes than other cities, but the map allows you to look more closely and to see where the community can be improved. And you can see also how it compares to other health outcomes in other areas. And this brings us to activity 1. So I know you're eager to check these out and look up your hometown or where you're located. So pick one of these resources that we just mentioned to explore and learn about your area for a few minutes. And whenever you're ready, we're going to come back, and I would like for you to share what you used and what you thought about it, maybe something that you learned or confirmed that might inform health program that you would like to offer. So I'll be quiet for about 5 minutes and let you guys choose one of these. You can click on the link in the handout that Margie offered earlier, and that will take you right to them. It'll also allow you to check out a couple if you're fast, but drop in the chat what you think.
And just going to add, Christy, there was a question in the Q&A about the status of county health rankings and roadmaps. It will be funded until December of 2026. And but after that, they won't be updating any of the data. So it's fine right now. They're working with it, but we kind of, as Christy mentioned, it should be usable for about another year after that because it takes a little bit of time for the data to refresh. So right now we're not sure, they're going to look for other funding, of course, but right now that's what we know about it. So I hope that clarifies it.
All right, I'm going to invite everybody to come on back if you're still out there searching. These will be there. Please continue to use them. Yeah, the map of social connections is particularly interesting. I agree. Oh, Jen said her rural communities are ranked the least healthy. All right. So I'd like to also mention before we move on, the Congressional District Health Dashboard, which is a companion to the City Health Dashboard. The Congressional District Health Dashboard launched in January of 2023 as the first of its kind resource, offering trusted data on health and its drivers for all 435 U.S. congressional districts and Washington, D.C. And you can find that link on the to that dashboard on the handout as well. Oh, good, Ed. I'm glad that that it's going to be helpful for you. And Margie just shared the link to the Congressional District Health Dashboard as well. All right. So once you've had a chance to review your community health needs, it's kind of like, okay, now what do you do? Where do you begin? So for your initial planning, I want you to first identify your intended or primary audience. So is it going to be older adults? Is it going to be working parents, stay-at-home moms, teenagers? Who is going to be your targeted audience? Then consider the type of outreach or programming that is appropriate for this audience. So teens will definitely be different than older adults. Those are just things, and they will all both be different than small children. So keep in mind, health outreach does not mean that you have to provide a 1 hour program with a speaker and activities and lots of coordinated events. Instead, think about it as a spectrum of engagement and what a manageable and meaningful outreach activity might look like based on your primary audience's needs, as well as the obstacles that we talked about earlier, your staffing, your funding. How much do you really have available to you time-wise to spend on and financial-wise to spend on these things? So maybe your audience would benefit from just being able to grab a flyer with information on it, or showing them what local resources to specific needs are. Or it might be highlighting particular information resources for them. It could be offering one-time or ongoing programming, depending on the needs. Or it might be offering a specific training. So there are a lot of options, and it is a spectrum. So consider what staff you have, the physical space you have available to offer these things, and any other factors that may, impact what you're able to do at any given moment, because that fluctuates too. There are a wide variety of programs that you can offer to address health needs for your community. These are a few categories just to help you get started brainstorming them. So when it comes to food access, it can look like cooking programming, gardening, growing your food, or offering a food pantry. Movement can be hosting a physical activity like walking or yoga or chair yoga. Maybe it's a class on injury or fall prevention. Access to care can mean partnering for vaccination clinics or diabetes education or smoking cessation, maybe hosting support groups or chronic disease management. Social work could look like having embedded social workers, or it could be giving them desk hours within your library during certain days a week where people could stop by and just know that they will find them there. Technology could look like telehealth services and digital literacy projects. Children and families you might want to offer sensory story time, music, movement, dance, you name it. There's so many things that could be done here. Veterinarian services. There could be vaccinations, or pet first aid, or pet loss or grief groups. Promoting information and reference services and collections could include curated lists of key and sensitive topics, things that people might be a little embarrassed about asking for. The pictures on these slides share a couple of examples of some of these things. So we see in there Carnegie Library of Pittsburgh, they offer bookmarks to help teens find materials on sensitive subjects without them having to ask the library or a staff member. Penn Hills Library has a food pantry. There's a teen hygiene health center at the Rockwood Makerspace in Multnomah County. And then there's the Central New York Library Resources Council. They have a healthy pet project that included workshops on how to prepare for disasters with your pet. So there's a wide range for everybody in the house. Hopefully these ideas are some fuel to build your own. You can take them again and modify them as you need to meet your needs of your community. Considerations that you might have while evaluating what might work for you is when making the case to offer health programming, think about the unique needs of your community. In addition to your intuition and observation, gather evidence knowing that administrative leaders, community leaders, funders will expect evidence of need, and these will help you show that. It's easy to always chase big, bold projects, but sometimes simple ideas and services are a good place to start, and they're easier to maintain. One simple question is this: does this project, idea, or program, is it easy to explain to others? Is it easy for you to get your idea and the support to the supporters that you need, to your funders, to your backers, to get leadership on board? So remember that. Is this project, idea, or program easy to explain? And that will help you garner the support you need. Be cautious, avoid competitions, especially those focused on weight loss. Know who you're inviting. For example, if you invite somebody in sales or from a company that sells supplements or diet plans or unproven cures, they might be interested in finding an audience or space within the library. However, you want to be cautious of that and who you invite in and set up because people trust us to present quality information. And some of these places can't verify or back up what their claims are. Registered dietitians and nutritionists are not the same thing. Anyone may call themselves a nutritionist. A registered or licensed dietitian is a recognized medical professional who has passed a national exam. Furthermore, there's a spectrum from weight loss focused practice to healthy eating at any weight philosophy. So you need to really consider what needs you're trying to meet and who the best practitioner to invite in and partner with would be. When working with new partners, authors, or speakers, consider the spectrum of opinions and care. So you want to be careful just, again, of who we're setting up as leaders and authority figures to our patrons. And here are some more inspiring ideas. There's a recent Newsweek article featured how libraries are becoming health hubs for food and fitness classes. Menominee Falls Public Library partnered with the American Heart Association to have blood pressure readings. Cobb County, Georgia, events in 2024 included partners to offer yoga, vaccines, and Medicare counseling. So some very, very different offerings. If these stories don't have your wheels turning yet, so we have more ideas and sources. Some of you may already have an idea for the type of programming and outreach you want to conduct, but if not, let's go get some ideas. So I'll briefly describe these websites and then invite you to explore them on your own, just like we did. So Let's Move in Libraries has program ideas, resources, and examples of library programming focused around movement and active living. They've got advice on where to begin, accessible programming, and liability. Web Junction, their help happens in libraries area. Check out the resources list. This is less a list of ideas and more dedicated resources for you to develop health programming, including webinars, communication ideas, detailed examples of projects. It is a deep resource and very much worth exploring to make your health programming a lighter lift for you. Includes resources on things like sustainability, helping your library be autism ready, creating a garden program or community pantry, and a whole lot more. Rural Health Literacy Toolkit has a program clearinghouse specifically dedicated to rural libraries, and they're focused on health literacy. Ready.gov is an emergency preparedness training and programs site. It's got social media toolkits too, so no reason to panic if you don't have your own marketing person or if you're in charge of marketing your own events. Go to see the examples, use what they've pre-made. Jaybrary Storytime Resources has food, movement, all sorts of ideas for story times with children. And then if you check out ALA, the programming librarian, they've got a lot of great resources there as well. Their link has been down, but Margie checked this morning and it's finally back up. So you can always go to the ALA website under programming librarian. We've got the NNLM, who is us. We've got past and current funded projects that can go to all sorts of populations. These are projects that we have awarded funding to reach communities from public libraries, academic libraries, community of groups, and all sorts of things, everyone in between. So check them out, see what other people are doing, and again, how you can modify them to your community. Then there's also the National Health Observances Toolkit and resources from the Office of Disease Prevention and Health Promotion. These fall more into raising awareness category. So not so much programming as much as, just raising awareness that this is an issue within your community. And now we're going to take a quick pause for activity 2. These, again, they're linked in the handout for today because not everyone will be interested in the same types of programming because every community is different. We're going to give you a few minutes to explore 1 or 2 of the resources that we talked about here just now, and anything that was appealing to you. If you don't already have a project in mind, you can find an idea to use for the remainder of your activities today. Choose a resource and find an interesting or promising idea for your community, ideally related to a need that you have noticed already. And this will be something maybe that you found in activity 1 that stood out to you from your research. So I'll be quiet for about 4 or 5 minutes so you can explore. And again, I invite you to share what you find and what worked, some ideas or something that you found particularly interesting, what sources that you found especially helpful, anything like that, drop it in the chat. We want to hear, we want to share. You've come across something that's really great, or you're interested in, drop it in the chat so we can all share and see. Make notes for yourself of something if you want to go back to check it out later. Don't want to forget these great ideas. Connie said, let's move in libraries, had great ideas for movement for adults and children, dance, chair, Zumba. A gardening club is a great idea. I've seen those be very popular. All therapy dog visits. Those are always very popular here. We've used therapy dog visits during exam time, and students love those when they come in to study. Yes, Allison pointed out that the programming librarian has maternal health information for programming. Oh, a seed library and plant exchange. Yes. Mindfulness meditation box. That sounds interesting. Persona building to help teens master mental health. That's a very timely one. All right, thank you guys so much for sharing those ideas, and continue to share if you haven't dropped it in there yet, and we're going to keep moving right along. So with an audience and an idea in mind, you've gathered your data. Now you've gathered some ideas of the types of programming that would help you meet what that data pointed out. We want to begin to think about who you might be able to partner with to enable or enhance the outreach and programming activity. So partners may have the expertise, audience experience, materials, or other resources that your program needs for success. You may be thinking, what does the library have to offer to a potential partner? But a local organization whose goals align with the library may need space that the library can offer. And sometimes they're able to reach a bigger population by coming to the library. The library, as we know, is a safe, accessible space to a lot of people who are intimidated by other institutions. So they would be more willing to come to the library than maybe to a business or a organization or an institution that they see as not for them. Types of partnerships to consider might be local government or public health offices, the library of your community college or university, or if that's where you are, you might want to partner with your local public library. Healthcare providers are great partners, food banks, agricultural nonprofits, maybe a SNAP educator, cooperatives, or the local extension bureau. They might do programs on food safety, nutrition, mental health, aging, anything. Anyone that worked with yours, let us know. Local authors and businesses are great partners as well. I know we partnered with the nutrition program at our local hospital once, and they had just gotten a grant for a little small rolly kitchen, and they had a little hot plate and were able to come in and talk about nutrition and prepare, show people how to use small recipes with little ingredients to make healthy dinners and lunches and snacks are the choices. Some of the smaller groups were able to learn how to cook with these things, and then they were able to give lectures to larger groups. So kind of catered to what everybody needed. Are there any other potential partners that you would add that maybe we didn't think about to share? Please drop them in the chat. Now, here is an example of a partnership at Brooklyn Public Central Library. The young adult librarian, Rakisha Kearns White, noticed that there was a need in her community. Many young people were experiencing period poverty. According to period.org in 2025, 24% of teens in the US struggled to afford period products, and 33% of teens reported missing at least 15 minutes of class for lack of period products. Statistics show that students of color, lower income students, and those living in rural places are most impacted by the lack of access to menstrual hygiene products. The library partnered with a nonprofit called the Cycle Alliance to start up a period pantry. This resource provides products and is surrounded with educational materials and information about reproductive health. So they were able to meet not just the physical need, but also an educational component as well. And here is another example where a community need was identified and a library developed a project, found partnerships and funding to meet those needs.
In Pottsboro, Texas, a rural community 90 miles north of Dallas, people have to travel to get to the doctor, and that's difficult for a lot of people here, and it's time-consuming. There's no public transportation, nor is there any ride-sharing available. So we stayed open throughout the pandemic so people could come here because people didn't have computers or internet subscriptions at home. Then we started getting a couple calls from people who wanted to have doctor's appointments. Libraries are perfectly positioned to work with telehealth because we're oftentimes the fastest internet connection in town. People trust librarians. It's a neutral space. We're accustomed to helping people with digital literacy skills. So it all came together to request funding to start a virtual health room here.
The original proposal that they pitched was to create a pilot telehealth site that would allow them to figure out best practices that they could distribute as a model to other libraries or other community organizations that are looking to do the same thing. And in that respect, it has been a resounding success. A crucial partner in this was also HSC Health, which is sort of the clinical support that they got for managing schedules, for setting up appointments with providers.
So as it stands right now, there are 77 counties that don't have a hospital. Telemedicine can be a real solution to a lot of these problems if we have both the equipment, and then you have to have someone special there to help lead the way and to acknowledge that it's actually safe.
NNLM made it possible for us to convert this old storage room filled with old books into a virtual health room, a room where people can come in, connect with healthcare providers, get the care they need closer to home. It's leading to people being healthier.
During COVID, I did not want to go sit in a doctor's office and expose myself to bigger things when I just had a minor health issue. So this made it where my safety came first, and it was private, easy, convenient. That's why I chose it.
It's a great model, and in fact, we've created a playbook because this is not about secret sauce. This is about let's make our communities healthier. Here's what we learned from this experience, and here's what we wish we had done a little bit differently. How fabulous would it be if all rural communities had this kind of access? Healthy people become healthy communities.
Whenever Pottsboro, Texas is on national news, I know we've done something worthwhile. And I am proud of being the first pioneer to do this, to be able to help other libraries across the country make this happen. And it's a reality now that would not have happened without NNLM.
All right. So what did you think? If there was anything you liked or found interesting about that video, again, pop it in the chat. We want this to be a conversation amongst all of us. So as we're moving through our process, we've gotten our health statistics for our communities, and we've brainstormed some ideas and now some partners. It's time to fill in the details to help your idea be realized and come more to reality. I'm going to share 2 ideas for formulating your plan, and then you can choose which best aligns for your organization and what you would like to do. The first method is 7 key questions. To help you think through the development of your activity, there are 7 key questions you can ask yourself. These questions are all multifaceted, but will help you recognize what pieces you have in place already and where you need to fill in any gaps. The first is who. Think about who your primary audience will be. Who in your organization can assist in the planning in the program? Who in your community might be expert or might know of an expert? Who is a potential partner for this outreach event? Next is what. What type of outreach activity do you wish to provide? Will you provide information, or will you offer a program with a speaker? What are the community health needs, and what evidence of this do you have? What resources are available from the National Library of Medicine or other agencies that you can use? Next is when. When will you offer your program? When should you schedule so that your audience and staff are available? Is it a one-time event? Should it coincide with Health Awareness Month? Is it an ongoing thing? Should it be a series? Now is where. Where will the program be held? Do you have space? Is it a kit to take home? Could it be an outreach to a senior center or a school? Is it accessible to the participants you're trying to reach? Why? Why do you want to offer this outreach to the community? Why do you want to offer this activity? Why will this benefit your library or your organization's community? How will it market? How will you market this to the community? How are you going to share it with others? Are there specific locations where your ideal audience frequents? Where can you go to reach them? How will you locate speakers if you're unaware of any? And how much? This question involves looking at how much time you or other staff have to invest in the activity, and also how much money it will cost. Now that's a lot. I'm going to share one more planning tool, and then we'll give you some time to look at both of these on your own. If you need buy-in from funders or other stakeholders, one way to explain your program or activity is through the use of a logic model. Use the reactions to let me know if you've used a logic model before or not. So if you can just click on the emoji and let me know. So a logic model is a visual representation of a program that illustrates how planned activities are linked to program results. A well-constructed logic model can make it easier to plan outreach programs by helping you to determine the resources and activities you need to achieve your desired results. As complicated as logic models might sound, they're actually very easy to use and very helpful from program idea to evaluation. At the very top is the goal of your activity program. Think of the inputs as the resources that will be used to support that activity or program. Then the activities are the main things that the project will do, or what it's going to provide, and who it's going to reach. Now, your outcomes are how many and what sort of observable, tangible results will be achieved. The short-term focuses on what will occur as a direct result of the activities, such as changes in knowledge, skills, or attitude. The assumptions are the beliefs about the environment and community. External factors include the positive and negative influences, the culture, economics, politics, and demographics of the community. Both assumptions and external factors should be confirmed before implementing the program. This template shows the types of things that you might be including in each area. For example, in your inputs include time, money, equipment. Activities, what you'll do, you might print bookmarks, provide a class, host a blood pressure screening. And then your outcomes might be that people have increased knowledge about evaluating health websites and that they then help their family members separate reliable information from more questionable information, and that they now know their numbers. Logic models don't have to be daunting. This is a very simplified example for a children's story time from the Library Research Service. So you can think of them a bit like if-then statements. If we do or have the things on the inputs and activities side, then we predict the outcome side will happen. For this type of logic model, you can start with the goal and long-term outcomes and then work your way back. In this case, the desired outcome is to give caregivers and children help caregivers teach children to learn early literacy skills. To get there, we're going to host a story time on early literacy. That's the activity, with an aim of 15 attendants. To do that, we need staff time, we need funding, we need supplies. If this way of planning appeals to you, there are many, many resources on developing logic models. And that brings us here to activity 3, and it's your turn. So choose either the 7 questions or the logic model from the handout and begin filling in the key pieces to implement your idea. I'll be quiet for about 4 minutes or so that you can start filling in your details. And then if you don't mind, when you come back, drop it in the chat and let us know if you use the 7 questions or the logic model, what you thought about that one, if you feel like it would work for you on other projects. So I'll be quiet now and y'all go ahead and start. All right, start making your way back. Let us know in the chat which one you like best if you have a preference, or you could even think of using both. So you could have the 7 questions for your idea development and then put it all together using a logic model. So you could actually do the best of both. So please let me know if you have any questions and we can go ahead about either one of these. We can address them. All right, we'll go ahead and move on. So now that your program or activity is starting to come in together, we want to touch briefly on how you'll get it to the folks that you're trying to reach. How are we going to reach your audience? What marketing ideas have you already used or seen that you might like to use? Maybe different things work for different areas. What works best in your area? This is the crowdsource part of the program, so share your ideas in the chat. Do you use social media? Is that work at reaching your target? It might work for reaching teens, but maybe not your older adults, or vice versa. Do you know which platform the teens are on versus where your older patrons are? Are there places to hang flyers? Do people prefer email newsletters? Do you find that your patrons go to your website and check it regularly? How do you get information to them? Let us know over in the chat what works best for you guys. Sending flyers to local groups and organizations. Yep. Mostly Facebook, yeah. Oh, you deliver calendars around the community. That's a good idea. I know working at a university library, we found that most of our faculty was on Twitter. When it was Twitter, our students were on Instagram, and our parents and grandparents and alumni were all on Facebook. So we had three very different audiences. A couple of brief notes about publicity and marketing. Once you've determined your primary audience and the type of activity, you want to consider what agencies in the community does your intended audience frequent? Are they at the rec center or a senior center? Are they in schools? What areas of your organization are they most likely to be in? It can sometimes be a process of trial and error to determine what marketing strategies work best for not just your particular community, but the audience within your community that you're trying to reach. Some ideas include the traditional use of flyers or signage on bulletin boards and in windows of local businesses. Additionally, information can be listed on website calendars, press releases, news feeds, and the use of social media sites. Remember, marketing doesn't mean that you have to be restricted to the walls of your library. You can place bookmarks, and local health clinics have flyers about upcoming lecture series or database searching classes in grocery stores. Hair and nail salons, child care centers, and community and faith-based organizations within your neighborhood are great settings to find your audience. In a library setting, it might even be useful to place additional signs about an upcoming health outreach event right near the stacks where the health materials are. This way, you may catch a casual browser, somebody who is already looking for that information to begin with. Don't forget the power of word of mouth and personal invitation. Two resources listed here that you may want to explore are the Public Library Association's Marketing Strategies page, and that's through ALA, and then the ACRL Library Marketing Outreach Guide. Also, some of the idea sources listed earlier, like the Programming Librarian, they also include marketing ideas as well. Many national institutes of health have digital materials that are free for you to use. No need to reconstruct the wheel if it's already, somebody else has already done it for you. There's nothing wrong with going by what others have already done, especially if it's been proven to work. Look under community outreach or materials on their websites. So the NIH has digital shareables on all sorts of items like mental health, and they have toolkits around different topics with resources and posters and talking topics. It's all there for you. It makes the job so much easier. You're not having to do it all on your own. So you can get printable flyers. This is what they might look like here. This is on mental health. And then they also, again, it saves you the trouble of having to translate things if you can get it already done for the your Spanish community as well. Creating programs from scratch can be a lot of work and worthwhile, but sometimes having a jump start is just what you need to get going. So next up, I'll share with you some resources from NLM and NNLM that can help you put together a health-related program with a little head start so you're not having to do it all from scratch. NNLM partners with a variety of organizations to offer projects, programs, and resources for libraries. There's Citizen Science Month. Citizen science or community science is a participation by the public to aid in real scientific research and discovery. NNLM has developed resources and programming with SciStarter, an organization focused on advancing engagement from the public in research. SciStarter maintains a directory of projects that members of the public may contribute to. It could be bird and insect counts, light pollution, animal behavior surveys, gamified research on Alzheimer's disease, and much more. Since 2016, SciStarter has organized Citizen Science Month with the NNLM and many other partners. Each April, librarians, scientists, facilitators, citizen science project leaders, and many others host events and programs that engage people from all walks of life in real science that matters to them. Providing health information through various formats is one way of providing health outreach. NNLM has developed an online toolkit to help busy library staff host popular and familiar library program like the Reading Club. The NNLM Reading Club is a curated list of health-themed books and a variety of genres to facilitate conversations on health and wellness topics. By reading different health topics in a safe setting, people can learn about health information, reducing the stigma around some of the diseases and health conditions. This also feels like a safe place because you're all there by choice to learn. Topics range from menopause to diabetes, caregiving to environmental health. The topic pages have resources. They've got videos and fact sheets on the topic. Book suggestions include fiction, memoirs, graphic novels, young adult, and even poetry and short stories. So there's something for everyone. Each topic has a curated list of resources, such as videos on dementia, and several books to select from for each health topic. Each book then includes a discussion guide to download and social media toolkit. This makes it easy to host a discussion. You're not having to create all of this on your own. And Margie has dropped the link right there in the chat so you can check it out. NNLM has a variety of resources to help design and implement health programs and resources for your library. Download free bookmarks and other materials that you can distribute. Browse NNLM's curated collection that features tools and programs and informational materials from NLM, the NIH, and other trusted health information, research data, outreach toolkits, training opportunities, and much more. The Public Libraries Resource Guide is focused on health information needs in libraries, including programming and collections information. And all of that is available for free. Now I have to say congratulations because this class earns 1.5 credits toward the Consumer Health Information specialization. The CHIS is a professional development program through the Medical Library Association, or MLA, that can help you gain skills in areas such as understanding your community, like we've done today, as well as finding and evaluating health information resources and improving health literacy. Taking a class like you are today will earn credits towards your Consumer Health Information Specialization, or CHIS. One thing that stops a lot of library staff from providing health information outreach is feeling like they don't know the resources or how to respond to the health questions. This program will help you with these skills and provide recognition for them. Throughout the year, we also offer free trainings in a variety of formats, including on-demand and recorded webinar sessions, so that you can take them at your own convenience. The classes are always free. There's an application fee through MLA for specialization, but NNLM can offer to reimburse you for the cost of the CHIS application. Just reach out to your region, and then we will be happy to help you cover the cost of those specializations. Getting the specialization on your own or with a group at your library can be a way to boost health information offerings in your community, something your library can promote as another service to your community. I hope you enjoyed learning about the health programming for your community with others. When we take a class with lots of ideas, it can be a little bit overwhelming and some things can get shelved because it's just too much. But I would like for you to reflect briefly and jot down maybe 3 things that really stood out to you. Then try to think of, what's your next step in health programming? I'll give you just a couple of minutes of quiet just so you can consolidate your thoughts and get organized. And then I invite you to share. I'd love to hear from you on what you might be taking forward from this class. It looks like a lot of you have some next steps already in mind and are walking away with some great ideas, and I love to see it. So as you know, community advocates, nurses, teachers, and librarians are trusted among the public within their families, social circles, and their work. Following NNLM, NLM, or NIH social media can help you stay current with resources that we offer, as well as learning opportunities to connect with people to connect people with accurate health information. Before we can genuinely help and support our communities, we must understand their strengths and barriers and be aware that health access looks different for everyone. Also, people with a variety of backgrounds and needs are entering our libraries, and learning is a crucial way to engage with people meaningfully and kindly. I'm going to invite you to complete our class evaluation. Margie has the evaluation link in the chat. These evaluations help us improve our classes. They demonstrate the value of the NNLM classes and provide the code to claim your credit toward your CHIS. At the end of the evaluation, you'll be asked if you want to earn an MLA CE. If you say yes, then you'll need to head over to medlib-ed to claim your credit and print your certificate. If you want to stay on the call, I can answer any of your questions. So hopefully you have got a lot of information from this. Again, Margie and I are going to stay here in case there are any questions, but that completes our program for today. If you are new to health programming, don't worry about starting small. You can start small. It doesn't have to be all or nothing. And if you're not, go for your big, bold idea. And please, 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 don't hesitate to reach back out later and share what you took from today and how you implemented it in your own program. We would love to hear how you took this and put it in action in your program at your library. So please let us know what kind of impact that you've had.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.